health matters, and the Pharmacy and Poisons Board is coming under increasing pressure to explain the circumstances under which it authorized the Russian COVID vaccine's emergency use, Sputnik. This comes days after the Pharmaceutical Society of Kenya queried the legality of PPB's actions in the absence of a board. The National Assembly's Health Committee took its officials to task, and Olive Burrows has those proceedings.
First, the officials at the Kenya Medical Supplies Authority stood accused of taking advantage of a pandemic to line their pockets. Now it's the Pharmacy and Poisons Board.
Poisons Board have taken advantage of the Emergency Authorization Act that was established during this time of pandemic to allow unscrupulous people to take advantage also of Kenyans. Because for you to go ahead and disregard the World Health Organization, even at the time before you concluded the vaccine was in the country, how did this company knew that we were going to get authorization?
The PPB taken to task over the circumstances under which it authorized the emergency use of the Sputnik V vaccine. That is, before the National Emergency Response Committee to the COVID pandemic pulled the plug.
I am worried, and with this committee we need to know who to hold responsible. Last time the ministry met with us, they said no single vial had left the storage or the cold system. Who authorized the 228 to be vaccinated using the Russian vaccine?
We did it of our own accord, was the government agency's response.
We don't seek permission from any quarters to issue authorization. We only depend on science. We didn't use the reliance mechanism where WHO requirement would have been important. We used the full dossier assessment mechanism. So it was now the Ministry of Health to take over this product that has been approved.
Hubris, a case of sense, is uncommon perhaps, but what the Oversight Committee on Health caught a whiff of was possible corruption.
These are new drugs. Even WHO has not authorized. You then have an emergency under which you are authorizing. What was the emergency? You are saying it was up to the ministry staff to now know how they apply this drug. Who has a duty to let the ministry know? We have a drug. Somebody is asking to import this drug. You are making a policy on this. We have the National Emergency Response Team.
Suspicions shared by the Pharmaceutical Society of Kenya, and if their decision to nip Sputnik in the bud for want of WHO approval is anything to go by, the Ministry of Health as well.
We stood the risk of reversing the gains that had been made so far in terms of the COVID response by engaging and allowing continued engagement of the private sector, and that we needed to first have a very robust system, putting in place systems to ensure at the end of the day that no Kenyan gets accounted.
Given the misgivings that already surround the COVID vaccines and the risk posed to public health, the people's representatives are demanding that the Ministry of Health get its house in order and fast.
The responsibility lies with Poisons Board. Actions must be taken against these officials.
Olive Burrows, NTV.